Well, look, we really are extremely proud of the success of this video course. We now come to the end. We left at last the sector, or actually the video of the contraindications. Of course there are, and they are. Marco will make us a list. Obviously, as always, also the rules of common sense are valid, besides those written that we'll give you now. However, I just wanted to thank you for joining us step by step. So I mostly as a cameraman in this role and shoulder for our Marco. It came out really well and I recommend this. Watch and watch again more times all of these videos because, of course, it will take time to put into practice. However, the great thing about this is that you can do all at your own pace, in your own time to acquire and assimilate them, and then put them into practice on your patients. More practice you do, the more your technique refines. Apparently, you will refine it and, of course, you too will feel a real virtuoso of manipulations. So I give the floor to Marco. So, Marco, do you want to explain the contraindications?
Okay, so this is in any case a key issue, even if you are a doctor, because you should know that patients can be manipulated. I personally manipulate every day, including my relatives. However, obviously there are contraindications for spinal manipulations. But you have to know that there are contraindications in any therapeutic approach, okay? So, contraindications may be classified as absolute and relative. The absolute contraindications are obviously all those cancer diseases. Therefore, patients with neoplasia can obviously not be manipulated, and also patients with infectious diseases, with fractures, of course, patients with advanced osteoporosis.
What grade?
So, considering that, of course, grade 2 can indeed not be manipulated, and I'll give you a personal tip. Be sure to do a detailed anamnesis of each individual patient. So obviously you don't have to do an interrogation, but you have to know the overall health of your patient, okay?
Then, for example, after this person, your colleague has done all these analyses and finds osteoporosis. Then, how can you continue? For example, in research of right questions, maybe even a quick questionnaire to start a kind of anamnesis.
So let me add, I'm sorry, that another condition which obviously excludes manipulation, spinal manipulative treatment, actually is the Pott's disease, which is a tuberculous spondylitis. Obviously there are other malformations, also the one of the cervical occipital hinge. And also the vertebra basilar insufficiency is an absolute contraindication to spinal manipulations. Then there are relative contraindications too, even if the patient is afraid of manipulations or you're able to educate him, and of course depending also on the patient's cognitive state. So even the states of serious psychiatric problems or severe depression, these are relative contraindications, and maybe also the operator, not perfectly master of the techniques. But obviously, no one is born as a perfect master of the techniques, but this could be a relative contraindication, okay?
Therefore, also the rules of common sense. We were talking with Marco. So I mean, going on, advancing the technique, do everything where you will feel safe and able to put into practice as you begin to master it. So maybe the first times will begin a little bit softer, okay? Of course, to understand where the limits of the barrier are and so on, you will approach gradually. You will not begin overdoing it with hyper-invasive treatments, right?
Of course. Look, obviously we all started from scratch. I remember the first manipulations I performed were on my father, my mother.
Poor them.
Yeah, but actually maybe they came out a little sore, but following the right levers and knowing what techniques to adopt, it is just a soreness. It is not, of course, an absolute contraindication. In that case, you shouldn't really manipulate the patient. So I want to add that on the manual there are also what we call red flags, which are in fact indicators of danger hidden among the symptoms. So I will help you listing which are these warning indicators so that you can show them to your patient to identify any contraindications to spinal manipulations. Okay?
Question. If a person comes to you and, for example, says he has pain in the thoracic spine, is it a case of treatment or no treatment?
Look, actually you see, it is listed, not surprisingly, among the red flags. But you have to know that the thoracic spine pain may also be due to thoracic spine dysfunctions. However, obviously it's not enough to say, okay, I have thoracic spinal pain, so I have a red flag, and maybe I cannot be manipulated. No, it's not enough. You always have to do a comprehensive anamnesis of your patient. So you have to do what is called initial evaluation, which I of course will explain you in detail in the manual, which I definitely encourage you to read, and that will help you a lot to understand when to manipulate and when not. Okay?
Question. Other cases, for example, of these rules, of where to forbear, basically, where to be cautious, I don't know. Maybe drug abuse? We were reading and thinking about it earlier. The use of
immunosuppressants also. Of course, obviously these are all red flags, but we say that the common sense rule, along with these red flags, they'll be a great help to decide whether it is appropriate to further investigate before manipulating the specific patient, or if you can manipulate him. You must know that first rule, if you're not a doctor, is to get patients with an assured medical diagnosis, okay? And so also with instrumental researchers.
So, the list of red flags we were talking about with Marco, of course, is long. However, it is always valid the rule of common sense. But to be sure not to leave out any aspects and any of those listed, Marco told me he sends you to read also the manual. In addition, in all the videos, you are taught in technical details when applying it, especially why to apply it and how, even with all the variants of the case. Furthermore, I recommend an integral part of the video course is the manual, in which Marco has really put a lot of time and a lot of love in, especially for the realization in the best professional manner, so that you can assess it and keep it always with you, so that you will always have the full picture of the whole situation. So, Marco, the course came out really well. Are you happy? Are you satisfied?
Very much.
Do you know that now you will have to record the whole course about joint manipulations?
Yes, peripheral manipulations, of course, are essential to have a comprehensive approach, because it is linked to spinal manipulations. Of course, that's what makes you do the difference.
Yeah, so I recommend, meanwhile, study very well all this course. Watch it and watch it again. In the meantime, we greet you. Marco and I continue to record all the new courses about joint manipulations, with which, I guarantee you, will come out something exceptional. For now, before we talk about it together, for the image quality level of recording it is something stratospheric. I mean that from the bottom, because right now I give you some preview, but one thing at a time. In the meanwhile, access to this course, so that then calmly we will wait for you and we will welcome you to step 2, basically to the next level, where we will unlock, you will, I always do the cameraman in this role, each joint, really in detail, until we crack, including the toes, then shoulders, knees,
all peripheral joints.
Where truly, Marco Aruffo, is a virtuoso. We send you a big hug. In the meantime, make sure to put it all into practice. So bye.
Goodbye. Bye.
And see you in the next video course.